Set up the patient. Place patient in Andago. Lift the patient. Adjust body weight support. Adjust fall limit. Place patient in Andago.
Andago enables easy setup for patients in wheelchairs. Push your patient into the Andago and position the shoulders under the suspension carrier. To facilitate sit to stand, place both feet of the patient on the floor. If you have handrails, the patient may use them to support and stabilize himself during sit to stand. You may need to adjust the height of the handrails or remove them according to your therapy goal.
Lift the patient.
After the patient is properly positioned, connect the suspension straps to the buckles on the harness. Use the lower buckle by default. Use the protectors to cover the unused buckles. Lift the patient by using the handheld control until the patient is in a suitable standing position.
Adjust body weight support.
Body weight support is the amount of unloading the Andago will provide your patient. There are two body weight support units, and the total amount of unloading is the sum of the two. Andago allows you to provide symmetric or asymmetric body weight support to your patient according to his needs. Symmetric body weight support is selected by default. Simply increase or decrease the amount of body weight support and it will be applied on both sides equally. Remember, the total amount is the sum of both sides. In order to provide asymmetric body weight support, select the right or left body weight support button according to the side you want to unload and increase unloading to the desired level. Then repeat for the other side. With this option, you can adjust independent unloading values for the right and left side. Adjust fall limit. Andago is a versatile medical device. For example, you can easily integrate it into your therapy sessions to have the patient perform balance exercises on an unstable surface or to train weight shifting with controlled loading. To do so, ensure the fall limit has been properly adjusted. The fall limit controls the amount of vertical displacement before the patient reaches the safety limits of Andago. You can identify the fall limit by looking at the distance between the arrow on the suspension carrier and the mechanical limit indicators. By pressing and holding the default fall limit button, your patient is able to walk on flat surfaces and able to step over or onto 13 centimeter tall obstacles. You can increase or decrease the vertical displacement by moving the suspension carrier up or down. If you move the carrier up, you will increase the upward vertical displacement, and your patient will be able to step over or onto taller obstacles. If you move the carrier down, you will increase the amount of downward displacement, and your patient will be able to do bending exercises like squats or balance exercises. Use the lift button to adjust the carrier height. When your patient reaches the mechanical limits as indicated by the orange lines, Andago will display an error message. Use these lines as a reference to see how much displacement you are providing to your patient.